I would describe it as a mixed report card.
58%. It's not a mark you'd be proud to show your parents, but that figure represents how many patients receiving involuntary care in BC have access to key legal safeguards, according to a new report by the province's ombudsperson.
Involuntary treatment plays an important role, but it should only, because of its coercive nature and because it involves taking away people's liberty, it should only happen in strict compliance with the Act.
That's the Mental Health Act, which mandates documentation on why a patient was admitted, how their course of treatment was decided upon, and whether they were informed of their rights, among other things.
In 2019, what we found was that province-wide documentation was happening in 28% of admissions, so it's more than doubled. So that's a good thing. But given, again, that this is the legal authority to detain people and treat people, our view is it should be 100%.
This report may be shocking to the public, but it really is just the reality of the medicine that a lot of us see practiced on a daily basis.
Dr. Jess Wilder is the co-founder of Doctors for Safer Drug Policy, and she says this missing documentation amounts to a material danger.
This puts patients at a tremendous amount of risk in so many myriad ways. I think this erodes trust as healthcare providers. If patients are afraid or unclear of the reasons that they could be held under the Mental Health Act against their will, they're less likely to access care.
Other critics question whether involuntary treatment is a good idea in the first place.
Relying on forced, coercive types of approaches is really not good science.
According to SFU professor Dr. Cora DeBeck, there isn't enough research to support its use, and in some cases, it can do more harm than good.
And there's a lot of risks and a lot of harms that come from pushing somebody into addiction treatment when they're not ready. We know it increases the risk of a potentially fatal overdose if they relapse, and relapse is something that's very common with substance use.
The Ministry of Health says that it's implemented 18 of 24 recommendations from the Ombudsperson's last report in 2019, with work ongoing to address several more. In Vancouver, Jack Rabb, City News.